I mean, think about this, right? We're talking about trust. It's such a human thing, right? I always think of this quote from Warren Buffett, and he states, trust is like the air we breathe. When it's present, nobody really notices. And when it's absent, everyone notices. I really think it kind of encapsulates our feelings about the importance of trust. Um, so maybe to unpack this a little bit, we can kind of talk through what that looks like in the healthcare setting. And um, you know, I from a human behavior perspective, like sociologically speaking, I feel like this is where narrative really comes into play and the power of story. And when I talk about that, it's really from the staff perspective. When you're talking to staff, it's a matter of really crafting a narrative around how AI systems impact them, making it about them, not about the technology, but about them, bringing in that human element. I think that's a term that we've been hearing a lot lately, that human element. But there's so much power in it, and making sure that we're focusing on the people, because every decision that we make regarding technology ultimately affects a human being. So really understanding the workflows, the pain points, um, really understanding the culture, and this is again from the vendor perspective. Like if I'm coming in as a vendor, I need to learn about my people. I need to learn about the culture. I need to learn the context. Really kind of diving into their world to understand what their day-to-day looks like. And through that process, that's where trust starts to involve. And I'm not talking about just establishing rapport. Rapport is a good start, but asking them about them, having them open up to you about what their day-to-day looks like. Um, Really, if you don't assimilate into the culture and really understand the context, you run a giant risk from a vendor perspective, just not having the deployment, the adoption be successful at all. Now, from a patient perspective, narrative also plays a very important role. You have to keep the story about them, talk about how their care is going to be impacted. And I think, again, from whether you're talking with staff or you're talking with patients, this is where it's important to note the importance of transparency in that storytelling, right? You want to be able to use language in a way that makes sense for the person that you're speaking with, the people that you're speaking with. We all are using a lot of different kinds of words, and taking a moment to step back and understand, oh, is this what you mean when you say this? Okay, well, this is what I meant when I said this. Language in and of itself is so incredibly powerful. And again, going back to the, anthropologically speaking, civilizations didn't exist without story. Story is what really brings ideas to life. Ideas don't take purchase in society without stories wrapped around them. So the idea of a technology, the assimilation of a technology into a healthcare setting, wrap it around a story and convey it in a way where you can meet people where they're at. That's where you start to build trust and understanding, and education comes into play there as well. So it's important to kind of think about those kind of elements. And in talking with, in my past life, working in healthcare systems, it really goes a long way when you're meeting one-on-one with people, understanding what their pain points are, being able to talk through those pain points and talk back to them. And again, focusing on that language, that storytelling goes a long way. So those are just some things that I think we need to be thinking about when we're talking about fostering trust in the healthcare space when it comes to AI implementation.